You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's called full mouth reconstruction. But we're talking about replacing missing teeth with dental implants. And with us, we have an expert on the topic. He is Kansas City's go-to oral surgeon, Dr. Newby. Dr. Newby, welcome to the program.
Hi, Randy. Thanks for having me. It's a pleasure to be on the show.
Sure, and I know you brought some photos, so we'll get to as many of those as we can. Now, for people that don't know your role as an oral surgeon, because you're a medical doctor, also have a dental degree, so who's the typical patient?
Typical patient is really everybody. I see people all the way from the very young all the way to the very old. So we see patients in their teenage years, when they're finishing high school, need their wisdom teeth out, going to college. We see patients that are maybe middle-aged, that are losing teeth or need teeth replaced, or maybe patients all the way that are in their 70s and 80s, maybe up to 100, that are denture wearers or missing a lot of teeth that need dental implants.
So you do this, and you have a magazine, and you were featured in this magazine, but that you say no more dentures. Correct. You do a lot of either, and I guess general dentists send you their patients that are wearing dentures that are sick of them, or people that need a full mouth of extractions and want a brand new set of teeth. Tell me about those two types of patients.
Well, there is mainly two types of patients that we see that need dental implants with a full mouth reconstruction. The first patient could be middle-aged or elderly. They've had multiple failing crowns, root canals, bridges. They have partial dentures. They're sick of the patchwork that they're getting every day, and they want a solution where they can get all their teeth back in one procedure. The other set of people are people that have lost their teeth a long time ago, right? So they've had failing bridge and crown work that has actually destroyed their teeth, or it's made them non-restorable. So now they're stuck with the denture. Why are they in a denture? Because a long time ago, there was no other options for them. A denture is what they got. Nowadays, we can actually restore their smile, the entire arch, we're using dental implants.
Now, tell me about your role. So you work together as a team with general dentists. Tell me about that.
Correct. We have a team approach. So we have a general dentist or a prosthodontist, someone who does the restorative work. So they do what they're best at. I do the surgical part. I do what I'm best at. So by using the team approach, we're able to deliver a higher quality product in a shorter amount of time. Something that's more likely to be successful, aesthetically pleasing, and make the patient happy.
Okay, good. Now, today's topic is, we call it, or you call it, full mouth reconstruction. That means these are people that aren't ready for a full mouth of extractions, but it's a combination of procedures. So for a working definition today, what is a full mouth reconstruction?
Full mouth reconstruction is a customized, detailed plan to treat the entire arch based on what that patient needs, okay? There's some times where we have to remove all the teeth and do dental implants and fix teeth to it. There's other times we can save the teeth. If we can save the teeth, a natural, healthy tooth is better than a dental implant. Obviously, a sick, non-healthy tooth is not better than a dental implant, but if we can save teeth, what happens? We give them a better result, and it actually ends up being cheaper for the patient. So Randy, by developing a unique treatment plan that's customized for that patient, instead of offering the same treatment plan to every single patient.
What do you mean that, same treatment
plan? There's some philosophies out there that say if you're missing 3 or more teeth, we might as well take out all the teeth and then give them 4 to 5 implants and a large bulky prosthesis on top of that. And when I see patients, I try to avoid taking out teeth if they're healthy and savable.
Okay.
Right? So we want to save the teeth if we possibly can. So by doing this, we don't have one size fits all or one treatment for every single patient. We're actually able to save teeth, save bone, save the patient money, and give them a treatment plan that is best for them.
Okay, now on these people, let's start, we're talking about, for people just tuning in, we're talking about like extreme smile makeovers, people that have broken down mouths, they're not quite ready for dentures or a full mouth of extractions, we're talking about full mouth reconstruction. And we had a discussion. So let's start with the back teeth. A lot of people are missing like 2 or 3 teeth in the back. Why is that a problem? Because you say that leads to other things.
Correct. The back teeth are actually some of the most important teeth, right? Why? Because the back teeth is where we do all our chewing. That's where the forces are the highest. You do 80% of your chewing with your first molar. So let's say you end up losing your molars and now you're having to chew with your front teeth. Your front teeth are not designed to chew with. They're just not. The angulation, the way that they're anchored to the bone, they're not made to chew with. Well, if you have no back teeth, what are you going to chew with? You're going to chew with your front teeth. So what does that happen? You have unequal forces on these teeth. Some people are wearing partials. Partial dentures actually connect to the healthy teeth, and they tend to wobble these teeth make them shift, make them move, and
So the
eventually
teeth start to flare out a little bit?
That's correct. They start flaring because they're chewing on their front teeth, and their front teeth are not designed to chew with, or they're wearing a partial denture, which is hooking to it. So every time you chew on that partial denture, that denture is actually wiggling the tooth and making it flare.
So why don't you like partial dentures?
Partial dentures are a patchwork, right, for replacing our missing teeth. They're not the best option for replacing missing teeth. So when you wear a partial denture, what happens is it actually causes the teeth to become mobile that they're connected to.
So
and you
what's a
actually
typical
get bone
case of a
loss.
partial denture, just so I understand? Like people missing like 3 or 4 teeth together?
3 or 4 teeth, usually sometimes on both sides, and that partial denture is now connected to the most posterior teeth or most back teeth. And so every time they're biting up and down on that partial denture, it's wiggling those back teeth loose. Then they lose them. Then they get another partial, right? So more patchwork, more expense. Now you're having bone loss the entire time in the back jaw because there's no teeth, right? In order to maintain bone, you have to have teeth or you have to have an implant. So if we could have actually seen these patients earlier and placed implants, we could have maintained the bone. We could have protected the adjacent teeth from being wiggled loose from an ill-fitting partial.
Because nobody wants to lose their teeth. So, we talked about this in the green room. There's about 30, 40 million people, depending on which Google search you do, the people wearing an upper lower denture. If you could have caught these people early, like when they were just missing 2 and 3 teeth, and maybe put in implants, you think you could have stopped a lot of that?
Absolutely. Why? Because you're giving them back a healthy, functioning smile, right? You're not only replacing what's already gone, but you're preserving the teeth that actually still remain. And in the goal of implant dentistry, our goal is to still preserve what remains. We want to preserve the teeth. We want to preserve the bone. We don't want to use the teeth as patchwork and anchor missing teeth to it and then eventually cause bigger problems down the road.
So why, if you're only missing 1 tooth, why would you want to get a dental implant over a traditional bridge?
Well,
for just 1 tooth?
There are several reasons why you'd want an implant over a bridge. First of all, in order to do a bridge, you actually have to shave all the enamel off the adjacent teeth, right? So you have 3 units or a 3-unit bridge that's going to connect to the 2 teeth to anchor it with the 1 tooth in between that's going to replace the tooth that's already missing. So now you've shaved off all the enamel. You have shortened the lifespan of that tooth. To make things even worse, bridges only last 10 to 15 years. So in the short run, it may be a cheaper option, but in the long run, it's more expensive. Why? Because now you have to keep replacing the bridge, replacing the bridge, replacing the bridge. It's much easier to just replace that 1 tooth with a dental implant. Now you have your tooth back. You don't have to touch the adjacent teeth. To make it even worse, let's say a bridge fails later down the road, and it's failed 3 or 4 times. You keep shaving off more tooth structure every time you do it. You get to the point, now you can't do another bridge. The other 2 teeth are now non-restorable. Why? It all started with that single tooth. So now instead of losing 1 tooth, you're losing 3 teeth.
Now, do people need a referral? Because I know you're a medical doctor, you're also a dentist. Does it cost more to go to an oral surgeon to get this done? And really my question, because I asked you that before, is do you need a referral to go to you first?
Absolutely, you do not need a referral. Patients are the ones that are in charge of their health, and they can go see who they want to see. So if you want to come see me, you can come see me. Now, if you don't have a dentist, and that's why you're coming to see me, because you don't have someone to work with and no one's referred you, I know a group of dentists that are extremely good to refer you to and find you to the right hands to get your general dentistry done.
Okay, good. You brought photos. What are we looking at over there?
All right. First patient here. So here's a patient that came to us and says, I do not like my smile.
Okay.
Okay. She was missing a lot of teeth, but she still had some teeth that she could save. Right. So some places they go to, they'd say, just take out all the remaining teeth. We'll do an implant over denture, or we'll do something different. I said, no, let's save the healthy teeth. We know that healthy teeth are the best thing you can have. So by giving her a unique treatment plan, we extracted the teeth that could not be restored or that are periodontal involved. We were able to save some teeth. We were able to place dental implants. We were able to save her money and give her back her healthy, beautiful smile. So this treatment plan was customized to her. We don't take a one treatment fits all kind of approach.
Now, and as far as dental implants, like people missing 2 and 3 teeth or a single tooth, how old can you be to do it?
There is no such thing as someone that's too old. You could be 80, 90, 100 years old.
What's your oldest patient?
My oldest patient was 99 years old.
Now, why would a 99-year-old want to do it?
Why? Because that's what's important to them, right? And especially when we get older, your teeth actually tend to be more important, right? Because you're retired, you tend not to work, and you tend to be more sociable, right? You want to enjoy your golden years. In fact, I remember going and visiting my grandparents. What's the first thing they want to do? They want to go out to eat, right? So as we get older, actually going out to eat, to socialize, to be around people, that becomes more important to us because we're not working anymore. You have to have teeth to do that. You have to have teeth to smile. You have to have teeth to be confident. You have to have teeth to say, let's go to this restaurant tonight and be able to order anything off the menu that you want to eat. So the people that don't have teeth, that are elderly and retired, they're not enjoying those years like they could be as if they did have teeth.
Now you're in Overland Park, which is an affluent area. Are there people that are missing like 4 or more teeth?
There are lots
Is
of
it all
people.
over the place?
Lots of people. In fact, the latest statistics showed 180 million people were missing at least one tooth or more. Didn't matter how rich you were, how poor you were, there's people from all different socioeconomic classes that are missing teeth.
Yeah, but what about people with bad gums? They have gum disease, like periodontal disease, with the bleeding and the bad breath and those things. Can they get it?
Yes, and a lot of time those patients are even told they can't get it, but actually those are good patients that actually have dental implant therapy. Why? The periodontal disease is associated with the teeth, it's associated with the gums. The bacteria, the bad bacteria that cause bleeding and cause swelling and cause gum disease live within the tooth. So if we can actually clean up the periodontal disease, clean up the gum tissue, let them heal, we can place a dental implant and actually cure them by placing implants.
Okay, good. So with this lady, and I apologize for interrupting.
Yes.
So she comes in, one of her options might have been a full mouth of dentures. You said you saved some of her teeth. Let's take a look at the after.
And so this is a person that came to us saying, I know that I have problems, I need my smile back. Dentures or anything that comes out is not an option. I want my teeth, I want them back in one day, right? So there was no option to place the implants and then come back and give her her teeth. She wanted them that day. So we saved the teeth that we could save, placed the implants that we needed to place, and then gave her teeth that day. Now look at her. You can even see just within the before and after picture that her smile is now bigger on the after picture.
Yeah.
She is now more confident. She appears more attractive. She appears more healthy. She appears smarter, all because we were able to give her a smile back.
Now you're an oral surgeon, right? And we know people don't like going to the dentist, and especially they know they're in trouble when they have to go to an oral surgeon. Do they tell you that? Like,
Yes.
No offense, doctor, but...
Every single day. There are patients that come in and say, hey, no offense, but I don't like being here. And I tell them I understand. You know, nobody wants to go and have someone put their hands in their mouth. Let's be honest. The other thing they say too is, I don't want to open for you. I have the worst smile you've ever possibly seen.
They actually say that?
Absolutely, absolutely. And the reason why is because they're needing help. They're ashamed of where they've been, and they haven't been given the options that they can to get their full smile back. And so I'm the guy they see that's saying, hey, you know, you don't have to be this way. I want to give you back your smile to where you can say, hey, I want to smile for you. I want to open for you. I want to be healthy for you, right? But they just need another option to know that we can give that to them.
You say these people don't smile.
That's correct.
Like they're walking around and they just... And could you spot them, by the way, as an oral surgeon?
Every day, every day. Sometimes you can tell that maybe that...
Like they're hiding something.
They're hiding something, their lip is not as full, maybe their cheeks are sunken in a little bit because they don't have teeth to support their lip or their cheeks. You notice when they talk, sometimes they talk with their hand over their mouth, or even when they're asked to smile, literally they're asked to smile and they put their hand over their mouth while they're smiling. So these people are easy to spot. They do not go out and laugh very hard, or when they laugh, they tend to turn away. They don't want anyone to see their teeth.
You have some more photos. What else are we looking at?
All right, this woman here came to us, not happy with her smile. She'd been seeing her dentist for years, having patchwork done here and there, failing crown and bridge work, failing bridges,
Is that
multiple
her
missing
mouth
teeth.
inside?
Yes.
me
In
take a
fact,
look
that's
at
what she looked like when she came to us.
Oh my goodness.
She was tired of all the temporary patchwork.
What do you mean?
She'd go to one dentist and say, hey, this tooth needs a crown. She'd go to another dentist, hey, this tooth needs a bridge. This tooth needs a root canal. So she was always getting treated for the individual teeth, but not for the entire smile.
Okay.
She said, I want to go to one place and I'm tired of doing this tooth, this bridge, this crown. She says, I want everything addressed all at once.
So did the general dentist refer you this patient?
That's correct.
Okay.
That's correct. The general dentist says, we need help. We want to get this patient the treatment that she deserves and fix everything all at once.
So when you see a patient like this in your chair, like what are you thinking? Like what you're going to do for this patient?
I think this case is a slam dunk. What I'm thinking is this woman has no idea what we're going to do for her. She has no idea that we're going to transform her looks. She has no idea we're going to transform her smile. She has no idea that we're going to make her smile healthier, her teeth better, and she's going to be able to eat and do what she wants to do.
So it's a tough time for her to chew? Like
Yes.
She has a tough time chewing?
Yes, she's missing all the teeth almost on one side, many teeth on the other side. And she has been going back and forth getting the patchwork done. She says, I want everything done at once. She's frustrated. That's why she came to us. She's frustrated, wants to get everything done. But when she came in, her primary goal was, I just want to get a few teeth back. And I knew right then and there that we could give her so much more, and she had no idea what we were going to do for her. So this lady, what were her options? Option 1, remove all of her teeth, put her in a denture. She definitely did not want that. Option 2, remove all of her teeth, give her a few implants with a big bulky prosthesis. Or option 3, save a few teeth and actually do a full mouth reconstruction. A treatment plan that is customized to her and what she deserves. All right, now take a look at this woman. Randy.
Looks good.
But yes, before and after, now she's smiling, showing even more teeth. And she had no idea she was going to look this good. In fact, when I sat her down for her appointment after we were done with this, I showed her the before and after. She literally looked at her teeth and said, I had no idea they were that bad. Why? Because she didn't smile that much. When she did smile, she didn't show any teeth. I guarantee you 2 or 3 weeks from now, she's going to be smiling even bigger and bigger and bigger because she's going to show more teeth and be more confident. Not only that, she can eat better. Now she can eat a salad. Now she can bite in a sandwich, not worry about the lettuce coming through. She can actually chew on her back teeth because she has teeth on one side before she didn't. And all of this is because we were able to do this treatment for her with dental implants.
Dentists, oral surgeons, you guys call this kind of like a full mouth case, full mouth reconstruction. What do the patients call it? Like just, they don't even know what to call it. They just say...
Patients just say, I want my teeth. I want my smile. That's all they know. They come in and they say, I know I don't want a denture, or I know I don't want this, but they do know what they do want. Nobody's ever came into me and said, I want a dental implant. Everyone comes into me and says, I want my teeth. Okay. I want to smile. I want to go eat what I want to eat. And I'm not able to do that now.
So for people that are getting this done, whether it's 1 tooth or 3 or 4 teeth, what should they look for in a dentist or oral surgeon that's going to be doing dental implants?
Well, number one, they want to look at the results and look at the work that they're doing, right? Because if they want a certain look or certain results, that's where they need to go. Number two, they need to go to someone that does it every day. They want to go to someone who specializes in it, someone that can handle any problems that arise, someone that spends extra training and additional years to learn how to do the technique correctly. You want to go to the most competent person you can to begin with.
Now, you're an oral surgeon, so you probably think the teeth are like the most important thing. How important is the smile, in your opinion?
Well, I do think the smile is important, but let me just tell you some facts, Randy. So people that smile, they tend to seem more confident. They seem to be more healthy. They also seem to be more trustworthy. In fact, Men's Fitness did, a health magazine, did a survey to say, when you're looking for a mate, what's the number one thing you look at? And the answer was a smile.
Smile.
Yes. In fact, 90% of our body is covered with clothes. So when you meet a person for the first time, what's the number one thing you're going to notice?
Smile.
It's the smile. The smile is the gateway into someone's personality. It's how you show love. It's how you show affection. It's how you show you're happy. It's what you show when you laugh. That's how important a smile is. In fact, even getting a job, it's important to smile. If you have twin sisters, identical sisters, resumes are exactly the same. You're interviewing them. One smile, happy, laughing. The other one's not smiling. Maybe she doesn't like her smile. Who are you going to hire? You're going to hire the person that's smiling, right? They seem more outgoing. They seem more ambitious.
So you don't necessarily hire the one with a prettier smile, but if one is smiling and one isn't, yeah, that makes sense.
Yes.
Hire the one that looks positive.
Absolutely, absolutely. Because they're going to show what you think you want for your company and what they want you to be. A smiling, happy employee and a happy person. Randy, science has shown that a smile is more attractive than a pout. Okay. In fact, look at Hollywood, look at the movies. Let's say you have someone, you want to make them the villain. What do? You give them gray teeth or give them dark teeth. Let's say you have someone you want to make them look not intelligent or maybe dumb. You remove a front tooth or give them buck teeth, right? Maybe you want to make someone look fake. What do? Give them big veneers, make them look
phony. Or poor for sure in the movies.
Absolutely.
If you want to make someone look poor, you give them bad teeth.
Absolutely. The poor person always has bad teeth. And these are all judgments that society makes every day based on just your teeth. That's how important a smile is.
So this is not for everyone. But obviously, if you don't like your teeth, do you have the feeling like, do something about it?
That's right. If you don't like your smile, you're not confident, you're not living life the way you want to live, do something about it. There's options out there. Options that didn't exist 20, 30 years ago. Now we can change your smile. Now we can give you back the lifestyle that you want.
You say that this is, for some of your patients, you've witnessed that their life changes. Elaborate on that.
Yes, I know firsthand that they are life-changing because I've seen it and patients have come and told me this. I remember a woman I treated a few years ago, Pam from Kentucky, right? She came to me after having all her teeth removed 3 years prior, right? And she says, I need help, I need something. And even myself, I tended to prejudge her a little bit, thinking maybe she couldn't afford it, maybe she didn't want it because she hadn't been back to the dentist in 3 years. And when I gave her options, she says, I want my teeth back, and I want them back in one day. So there, again, showed me how important it was and not to judge patients. So we did the procedure, gave her her teeth back in one day. I remember after 6 months of healing, giving her a final set of teeth, and it was around November time. And I asked her, just to make small talk, Pam, what are you doing for Thanksgiving? Have any plans?
Okay.
And this is when she said, yes, actually, I do. I am having my grandchildren and my family over for Thanksgiving dinner at my house for the first time in over 3 years. And I said, why in the first time in over 3 years? Assuming, what, you don't like your family? She said, no. She said, I lost my teeth 3 years ago. And she says, I did not like having my grandchildren sit on my lap and say, Grandma, you don't have any teeth. So she quit going to family functions She quit being around her friends. She kept going out, quit going out to eat because she was so embarrassed and self-conscious about where she was. The minute we gave her teeth back, now she's out eating with friends again. She's socializing. She's smiling. When she first came into the clinic, I could not get her to smile.
Okay.
I asked her 5 different times, please smile so I can get photos ahead of time. She would not smile. Now she comes into the clinic, wouldn't even recognize the same person. She cannot stop smiling. And the biggest thing that I thought was the most heartwarming was over 3 years of not seeing her family and having family functions together. Now she's hosting Thanksgiving at her house.
She's back.
Because she's got her new smile back. Randy, I have this other patient, retired truck driver, okay? He had a very high stress job, always on the road, ground his teeth a lot, lost his back teeth. And now that he's retired, he likes to go out and eat more often with his wife, with his family and other things, but he was embarrassed going to restaurants because he had no back teeth. He had to really
Is that
watch.
very common? Like a lot of people missing back teeth?
Absolutely. If you have missing back teeth or you're missing multiple teeth or they're loose, you go to a restaurant, it's very difficult to order from the menu, especially what you want to eat. And this guy was a big meat eater. He loved eating meat. He was embarrassed about that because he would have to go to the menu and he would, when he was out with friends and family, and have to literally limit what he could chew and what he could eat. Once we did the procedure, did the dental implants, filled in the missing gaps, brand new person again. Now he's smiling, he's able to eat whatever he wants to eat. He's even coming back and saying, I've eaten barbecue for the first time in 3 years, eating meat off of the rib and not having to use it with the...
Just by replacing his back teeth?
Absolutely, absolutely. Just by replacing his back teeth. Because remember, you do most of your chewing with your back teeth.
Now what if you're just missing teeth on one side? Definitely fill in those holes as well?
Yes, absolutely. If you're missing teeth only on one side, that means you're chewing with the other, right? Because you're not going to chew on the side you don't have teeth. You can't. Right? So if you're only chewing on one side, what happens? You overwork the muscles on that side, you overload the joint, you can have TMJ problems, neck issues, things like that. You also don't have a balanced occlusion. You're also going to wear out those teeth. You're not going to have a balanced bite, right? Your bite is not going to be equal on both sides.
So what's going to happen?
So what's going to happen is the teeth on this side are going to shift. You're going to wear out the teeth faster on this side, and you're going to end up losing more teeth. You're going to have more difficulties chewing. It's very important to have both sides be equal and chew on both sides equally. So the men, a lot of times they put things off. Men tend not to go to doctors as much as they should. So they don't come in until they're in pain. And usually when you're in pain, you have a lot of big problems. In fact, a lot of times when I see men that come in that need a full mouth reconstruction, it's because their spouse or their wife has brought them in.
Really?
Yes, they say.
So the wife has to drag them in?
The wife says you have problems and we need to fix this. And reluctantly, after years and years, they finally come in. And
Are they sick of them complaining? Is that what's going on?
Yes, probably a lot of it, actually. That, and the wife cares about their teeth and says we need to do something about it. So it's a good motivation for them.
So that's common that the wife brings them in?
Absolutely, absolutely. So the wife brings them in, says, I want him to smile more. I want him to chew more. I want him to be healthier and do the things that he used to do.
And what's he doing? Just sitting there in the chair listening?
Like most men, yes.
Okay.
So after we give him over a detailed treatment plan, and he says, yes, this is what we need to do. We talk to the spouse about it. We get the treatment completely done. He's back to being his own self again, right? He's making jokes. He's back to the man that she married originally. And in fact, they come back and say, I wish I would have done this years before.
We talked a little bit about your wife works in the practice. She's a registered nurse. She helps with some of the patients. And let's talk about sedation for a moment, because you're big on sedation. Are most of these people IV sedated on this?
Yes, almost all the patients I treat are under sedation. In fact, all the big full mouth reconstructions, dental implants, we always want to use the sedation. Why? Because statistically it's safer. Patient's not moving around. Also, these procedures are surgery, so they're invasive, they're uncomfortable to be awake. Whenever they're getting shots or they're having to drill on teeth or bones, etc., they'd rather be asleep. In fact, a lot of times, patients come from general dentists that place their own implants, but say, I want to be sedated. Right?
Okay.
And so since a lot of most general dentists don't do sedation, they come to us specifically for that part. In fact, we have patients that come in that only need one tooth out.
Okay.
And they are deathly afraid of the dentist. And they are even more deathly afraid of having surgery, right? Because the dental chair is the last place you want to be. It's especially the last place you want to be if you have to have surgery. So how do we do that? We do offer IV sedation.
So how does that work? I mean, take me through that. So you numb them up, give them a little injection. Is that kind of how it works?
That's correct. We actually can start the IV first before we even get them numb, so they don't even remember the shots. Okay. All they remember is they got an IV, we're talking to them. Next thing you know, they wake up in the office. Sometimes they remember that. Sometimes they wake up at home.
Okay.
I don't know how many patients I've called the next day to see how they're doing, and they're like, I don't remember anything. I remember coming in, you saying hi, and after that, next thing I know, I woke up on my couch.
And you have a registered nurse right there to kind of help assist and monitor some of these things.
That's correct. She starts all the IVs and she monitors the patient, so we make sure that we're safe delivering sedation in the office. Absolutely.
Okay, so no more excuses. If you're missing 1, 2, 3 teeth, 4 teeth, and especially if you're trying to avoid dentures, come in, get evaluated.
Okay.
So you offer free consultations?
That's correct. That's correct. Free consultations. We take x-rays to give them a diagnosis that they need, and we give them a unique, customized treatment plan for what they need.
Are you ever surprised at like how people react to just, giving them their teeth back?
Yes, Randy, I'm surprised every single time we do one of these cases, and I'll tell you why. All right. Imagine this. A person's not happy with their smile. Every day they look in the mirror and they see someone that they don't want to be. They're not socializing, they're not smiling, they're not happy with their appearance, right? So they get used to that same appearance, that same problem that's bothering them day in and day out, and they get used to that. They come to our clinic, we're able to give them back their teeth in one day and one visit. Next thing you know, they wake up, they grab a mirror, they don't recognize the person in the mirror. They have no idea who that is, and then they realize that that's them. That's their smile. And they know from that point on, their life is going to be different from this day forward.
Really?
Yes.
Well,
absolutely.
good for you. You believe that because you see it.
Absolutely. I've had to do several procedures on people, taking out teeth, wisdom teeth, etc. No one's ever jumped up and gave me a hug for taking out their wisdom teeth. But I will tell you this, every patient I've done this for, that I've given back their smile and their confidence, they always give me a hug and say, thank you so much for what you've done for me.
Okay, good. So don't put it off.
Do not put it off. Absolutely not.
Come in, get evaluated, free consultation.
Yes.
And know your options.
Yes. Anyone that is missing one tooth or more, or has tooth problems, they know they're going to be missing teeth. Come in, let us evaluate you. We can tell you what your options are. We can replace whatever needs to be replaced. We'll be happy to see you and give you the treatment that you need and deserve.
Now, insurance, though, we didn't talk about this. Even the best dental insurance only covers a very small portion. Medicare, Medicaid doesn't cover this at all. So what's the answer?
Correct. So we have a partnership with several different companies that allow you to finance it, right?
Okay.
So they can actually come in, partner with this company, and they can make low monthly payments.
So you have to have decent credit, we should say, to get this, right?
Yes, you have to have decent credit. You don't have to have great credit, but you have to have decent credit. But let me tell you this, we're getting people approved every single day that need it.
So this is common to finance.
This is absolutely
procedures.
common. And our job, I feel, as a practice, is we need to remove every single barrier that we can to give them the treatment they need. So by partnering with these lending companies, we're able to break down this barrier. It's more affordable than people would think.
Okay, so visit the website, come in for a free consultation.
Yeah, visit the website, check it out. There's a lot of good information on there. Give us a call. We have more information. Then come see us.
Okay, good. Thanks again. You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.